As the summer season approaches, Quebec is actually facing another season, the flu season, something that usually strikes in the winter. But in this case, it arrived in April, and experts say it's affecting mostly children and young adults. To discuss this, I'm joined by Dr. Jessie Papenburg, a pediatric infectious disease specialist at the Montreal Children's Hospital. Dr. Papenburg, thank you so much for being here.
It's a pleasure.
Thank you. So usually the flu season in Quebec begins at the end of November and continues until the end of February or March. Now, we know that public health said that in April that this was rare. Why do you think the influenza is here now?
Well, I think what happened was that the usual seasonality of influenza was, I would say, delayed by all the public health measures that were still in place to help fight the COVID-19 pandemic, in particular the Omicron waves that we witnessed over the holidays and then in the early part of 2022. Now, with the progressive relaxation of these public health measures and more social mixing, it has allowed for influenza to now kind of pick up in terms of its activity and circulate in the population at a later date than usual.
And now cases of children and young adults with flu are being seen more than other age groups. Why is that, and what have you seen in the hospital?
But we have certainly seen a lot of emergency department visits for influenza and other respiratory viruses at the Montreal Children's Hospital. We have seen hospitalizations as well due to influenza, but I wouldn't say that it's been a particularly severe year in terms of these more severe cases. I would say it's maybe even below average in terms of the number of hospitalizations for influenza that we've had. But why does this season seem to be affecting children and young adults more than older adults? That's a bit of a head scratcher.
And there are many viruses going around now, of course, COVID-19, and there are more confirmed cases of monkeypox, Montreal seeming to be the epicenter of it in the country. There's also acute hepatitis in children. Now, how does one decipher if they have the flu specifically?
Well, what's classic in terms of the manifestations of the flu are fever, cough, and possibly sore throat or muscle aches. This is what we would call a typical influenza-like illness. And when there's a lot of influenza circulating in the community, the chance that this type of disease or this types of manifestations are produced by influenza are quite high. And what we're seeing right now is that COVID-19, the levels are coming down. The other infections you mentioned, whether it be monkeypox or acute hepatitis in children that's not yet diagnosed, are very rare still, thankfully, and present very differently. But so I think right now, if a person has cough and fever, there's a good chance that that could be influenza.
Thank you so much for joining us, Dr. Papenburg.
Pleasure.